And our attendees are coming in.
Okay.
If you open your participants, you'll see.
Okay. Welcome, everybody. We are just going to give you all a little bit more time to let everybody get signed into the webinar. But while we're waiting, I just wanted to say that myself, Dr. Adams, and Dr. Sutton, we're all so excited to be talking with you guys tonight. Honestly, we've been talking about it all day. We had such a fun time having our first part 1 virtual session with you guys last night, talking about history of UNMC Dermatology, our brand new residency program, and kind of, you know, how we our plans for growing in the future. And so tonight our goal is really to just kind of focus in on the finer details of, you know, what it would be like if you were to be a UNMC dermatology resident. I think kind of before we get going too far into things, we can kind of do some more kind of formal introductions. And so my name's Megan Arthur, and I am one of the Associate Program Directors.
Hi, everyone. My name is Jennifer Adams. I know it says Abrams on the screen. I'm in the middle of changing my name, but I'm also another Associate Residency Program Director.
Hi, good evening, everybody. My name is Adam Sutton. I am really excited to be here tonight to chat with all of you and be here with Dr. Adams and Dr. Arthur. And I am one of the dermatologists and Mohs surgeon in our department. So.
Okay. Well, I think we'll go ahead and get things kicked off. The first thing that I wanted to go over is I just thought it'd be really helpful for you all to hear kind of what as faculty we came up with kind of what we wanted to strive for with forming this residency. And so our mission statement is listed here as far as our goals. And so the mission of UNMC Dermatology Residency Program is to provide comprehensive educational experience and foundation in dermatology. And I hope that by the end of tonight's presentation that you'll feel like we are fully capable and able of doing that, because we've got you know, some really wonderful rotations and multiple disciplinary clinics for our residents. And our core focus in the is in the development of future leaders in dermatology and in their chosen medical communities. And that really gets to the point that, you know, our job as faculty for residents is to help grow you into the dermatologist that you want to be. And so that looks different for everybody. And our hope is that you feel prepared and ready for any and all situations that you're put in as a dermatologist, whether you're at a big academic institution or working solo in a rural practice. We want you to be prepared. UNMC Dermatology is firmly committed to a focus on education and mentorship. We are guided by compassionate and leading-edge patient care with a team-based approach. We strive to serve our urban and surrounding rural communities as well as underserved populations, both locally and abroad. And Dr. Adams is going to talk about that in greater detail with you guys later on. We aim to instill curiosity and a sense of innovation in research, quality improvement, and forward-thinking solutions for the healthcare delivery of tomorrow. And so if that doesn't give you goosebumps, I don't know what will. And so we're going to go ahead and switch over to Dr. Adams here to fill us all in on the faculty members.
All right, great way to kick off. And just to mention as well, if you guys have any questions that come up during the webinar, feel free to enter them in the Q&A section at the very bottom of your screen. We're going to have some time at the very end where we can go through one by one and just make sure that we answer all your questions. So this is the team that kind of came up with those goals and those aims that we were looking to build on. And something to know about us, Dr. Wysong went in further detail about the startup mentality and really starting this department from the ground on up. And we're now, you know, closing in on we have those 2 years under our belt. And with the residency starting off, something to keep in mind is that all the faculty that came on board here they came here for this challenge, this opportunity to build the department of our dreams and the residency program of our dreams, and what we would hope to give the residents that we're training. And so everyone on this page is just so passionate and so in love with teaching and dermatology. And although we cover the entire breadth of dermatology, each one of us has a specialized expertise in different areas of the field. And we are so excited to share that with you all, and just really passionate about that. And so that's our biggest asset to you. The best thing that we can offer you in a residency training program is committed faculty that love teaching and are passionate about the field. So starting off, Dr. Wysong had already gone through these last night, but I'll give you another overview. So I'm Jennifer Adams. I practice medical dermatology, love complex medical dermatology, have a particular interest in infectious tropical medicine dermatology as well. With that, we'll talk a little bit about Hansen's disease later on, emerging infectious diseases, and HIV dermatology, and even just day-to-day how that applies. Dr. Megan Arthur, who did our introduction, she does medical dermatology, general medical dermatology, and complex medical dermatology. She also is our expert in all things room derm, and actually runs a multidisciplinary clinic every single month, every other week now, right?
Yep.
And then Dr. Corey Georgeson is joining us very shortly in days' time. So he's actually a dermatology trained dermatopathologist. So he's doing a lot of our teaching for the department. He's one of our core faculty. He also did a separate fellowship in training with inpatient teledermatology, so brings a lot of knowledge to the field of our practice there. He also practices general medical dermatology, and he'll be contributing as a teacher there. Dr. Christy Hayes, she's just been this powerhouse of UNMC Nebraska Medicine Dermatology, and you saw how she has really been a big part of our history as a department as well. So she practices general medical dermatology, but she actually completed a pediatric residency in addition to her dermatology residency, and she's also boarded in pediatric dermatology. She also has a particular interest in skin of color. Dr. Ronald Suleski, he is our director of laser and cosmetic dermatology, but he also practices general medical dermatology, and he has a big role to play in our surgical dermatology program as well. Dr. Adam Sutton, he's right there above you. So he's a fellowship trained Mohs surgeon, as you heard. He also has his MBA, so he's very interested in quality improvement projects and making sure that the business side of our department, that we learn all of those aspects, which is important as you leave residency as well. He'll talk to you a little bit about all the things derm surge going on in our program. And Dr. Ashley Wysong, who hopefully some of you joined last night, she's our chairwoman, and she has started this department from the ground up. Very inspirational if you've ever heard her speak. So she is also a fellowship trained Mohs surgeon who came here to start our founding chairwoman. She practices general medical dermatology. She's running our inpatient dermatology service at this point. She's kind of wears all the hats, and wherever things are needed, she's a jack of all trades. So this is our core group here, and another thing to know about us is that we have all trained in different locations all around the United States, and so I think that just makes us stronger together, that we all have different perspectives, and we hope that you can take from each one of us things that are helpful for your future. So this is just breaking it down into the different groups. Everything I just said, those practicing general dermatology up at top. We have our derm surgeons there as well. Our dermatopathologists, you saw Dr. Georgeson on the prior slide. We also have 2 path-trained dermatopathologists. They've been doing it for many years, Dr. Scott Lauer and Dr. DeMaio, who we work really closely with, and our residents will be reading Derm Pass slides with them as well. We have courtesy faculty that we work with closely on some of our cases, from ENT, head and neck surgery, oncology, and the Division of Rheumatology. Dr. Medlin is here every other week for the Rheum Derm Clinic. Volunteer faculty as well, including mostly at the VA, which we'll talk about a little bit later, and then Kara Tomlinson, who helps us with all things administrative.
And so this is our education team, and we meet weekly to discuss everything and anything from our medical students to the residents and what we can do to continue to better their experience. And so Dr. Wysong, whom, like Dr. Adams said, is not only our chairwoman, she does wear all the hats, she's our program director as well. And we're very, very lucky to have her leading our team. Myself and Dr. Adams are the Associate Residency Program Directors. Mackenzie Demmer is our new Residency Program Coordinator, and you'll be able to talk with our residents tomorrow evening, but they just absolutely loved her, and we're just so excited to have her joining our team. And then Tammy O'Donnell is our Education Coordinator for the department, and really, I mean, she did all of the legwork with making these webinar series possible. And so very grateful and thankful to her for everything that she's done. And so this would be kind of the core education team that's kind of going to be going forward, again, to just making sure that everything's going smoothly, that all kind of medical students and residents are having a great experience. And here are our superstar residents. And so these guys are, you know, almost 2 months in at this point. So we've got Dr. Dylan Clary, Dr. Tyler Evans, and Dr. Ritu Swally. And you guys are gonna get to know them very well tomorrow night. They're gonna give you you know, all the information that you didn't feel comfortable asking us, essentially. And honestly, you know, these guys, we're so proud of them. They are going to be essentially chief residents for all 3 years of being dermatology residents here with us. They've got the big task of, you know, setting the tone for the culture here at our UNMC residency. And, you know, we feel like we got just the cream of the crop when we got these guys. And I know that you all would really enjoy working side by side with them. We had a ton of fun welcoming them into the department the first day that they were here. We were very COVID conscious as far as any celebrations go, but you can see here in the top left-hand corner, so that's our the dermatology resident room and library. And so they each kind of have their own dedicated computer and workspace. We got them these really fun gift baskets full of goodies, so when they're, you know, writing notes after clinic, they've got something to kind of keep their energy going and whatnot. And so, yeah, it's just been really, I mean, for all of us faculty who have been working so hard and wanting this so bad, it's been really just a dream to see it all come to fruition. And so we are just even more excited to continue to grow our family as we have more and more residents join us.
So the very first week, we basically sat down with our residents who you just saw and asked them what they wanted in a program. And so they created their own code of conduct, with their expectations of each other and themselves that they had put together. I think it really highlights what we're looking for in residents in the future. These are your coworkers, and this is what they expect of themselves and others working with them. So forming a cohesive, non-competitive group, so really focusing on teamwork, helping each other out, openly communicating with each other and being responsive as well, creating an environment where there's constructive feedback and criticism and learning from each other, but with heartfelt appreciation for each other. Recognizing an all hands on deck attitude. So this is, all these things are reflected, you'll notice, with the staff and with the faculty as well. And this is something we really believe on. There's no task beneath any of us. You need to know how to do everything anyway, but but really helping each other out and making sure that we all can get to our goals together. Upholding a high standard of professionalism, maintaining camaraderie amongst each other, making sure that we establish ourselves and form that reputation as being a knowledgeable and helpful consult service, since there wasn't a consult service here before our department was established a couple of years ago, and we've really grown quite a long ways, and people understand the value of dermatology when you're out there working side by side with other specialties. Providing excellent patient care with an emphasis on empathy. We talked about this last night and how absolutely vital quality patient care is, and that is our number one here, and making sure we take good care of people. Acting as strong, approachable mentors for learners, serving as stewards for the residency program beyond, and hopefully they do that tomorrow for you guys, and being present in educational interactions and in the patient care setting, assuming positive intent with each other and striving to be the best dermatologists that they can be, and building a great dermatology residency program. So we're constantly getting feedback from the residents and from the faculty, and everyone's working together to build this into the best possible program that we can.
And so listed here, we're going to kind of start talking about some of the rotations and whatnot that that we have for our residents. And so these are kind of the main ones that we'll go over. We'll go over each of them in a little bit more detail. You know, we've got just kind of general dermatology clinics, which is kind of the bulk of what you're going to be doing when you're a first-year dermatology resident. We've got some hybrid rotations where you're doing general dermatology in addition to having some dedicated time to focus on research interests that you have, whether that be, you know, writing review articles or working on quality improvement with Dr. Sutton, you know, whatever that may be. Specifically, as you get into some of your more senior years, we're kind of highlighting some additional time in our multidisciplinary specialty clinics, which we'll talk about. We've got our pediatrics rotation, our consult service, which is very robust at this time. And then we've got kind of 3 towers within the hospital that we take consults at for. So we'll review all of that. Dermatologic surgery, Dr. Sutton's going to talk about in more depth. Dermatopathology is kind of an interesting one, and I actually don't think we have an extra slide on this later, so I'll just take a little bit of time to talk about this now. But so we actually have a Derm Path 1 and a Derm Path 2 rotation. So in Derm Path 1, you're basically going to be working side by side all day long with Dr. Georgeson and just kind of getting in his mind, thinking how he thinks, doing what he does. And so he does kind of the general dermatology clinics in the morning, and then he's going to be doing sign out for Derm Path in the afternoons. And so you'll be able to get a lot of that really good clinical pathologic correlation that really kind of helps just kind of, you know, absorb and kind of really solidify some of these diagnoses that can be otherwise really difficult to learn. And then Derm Path 2, that rotation is going to be when you're a little bit later on in your training, and essentially you'll just be rotating with any one of those 3 dermatopathologists that's on service at that time, and all you'll be doing is sign out. And so it'll be really high volumes of lots of slide cases. So that'll be really good experience. And then we'll talk about in a little bit more depth about the different electives that are going to be available. But really, you know, I think hopefully you'll kind of see the theme here is that we want you to become the type of dermatologist that you want to be. And so we've really tried to find ways to put a personal touch on your residency education here with us so that you're able to achieve that. And so this is kind of what the schedule for our current residents look like. Now, keeping in mind, there's just 3 residents right now. So it's on the next slide, we're going to go over what it will look like when we have a full complement of all 9 dermatology residents. So right now, our residents are kind of doing 2-month blocks of their rotations. And you can see there's kind of a mix of dermatologic surgery, consultative dermatology, general dermatology, pediatrics, and then there's the Derm Path 1, as Dr. Georgeson is going to be joining us here just within a matter of a couple of weeks. And so they'll be starting to rotate with him. And then this is what our kind of goal is long term, again, for when we have 3 residents each year. And so we're going to go into this in a little bit more detail so that it's a little bit easier to process and whatnot. But essentially, you're going to be getting some degree of dermatologic surgery, consults, VA time, and dermatopathology really every single year that you're here with us. And so we'll talk about that a little bit more here in just a moment.
So as far as locations of where you're going to be practicing, a key to keep in mind is we do not have you driving around town to multiple different locations throughout the day. You're at one hospital, one setting, but it's really great because during your time in residency, you're able to practice with different patient populations at our different locations. And so it's really helpful for seeing all those different groups of patients. So right here on the left, you see Lauritzen Outpatient Center. That is our main hub, our mothership. That's where the residency, the offices are located, the library is located. We have our main dermatology clinic and procedural rooms there. So that's where you're going to be, especially early on for the most part in the beginning. We also have the main hospital up here on the top. And this is the Fred and Pamela Buffett Cancer Center. So those are going to be locations where you're going to be rotating through, seeing consult patients, running around the hospital, seeing all the great inpatient consultation cases, which we'll go over very soon in further detail. And these are some of our satellite clinics where the different faculty are practicing right now. We'll go over some sites that are planning to be opened up in the next year or two in a little bit once we get to those slides. But these are the ones where we're at right now. The important thing to keep in mind is that although Omaha, the metro area, is over 1 million people, it's still something where you can basically drive anywhere you need to be in a good 15 minutes. And so you're not going to be stuck in traffic for an hour and a half getting around to these sites. But we have Village Point, which is a major hub where we're actually going to be opening up our cosmetic and aesthetic center out there with Dr. Suleski and a multidisciplinary clinic with our plastic surgery and ENT colleagues out there. But right now we see general medical dermatology out there. We do excisions out there. We do the whole breadth of dermatology there. Chalco Clinic, where Dr. Arthur is at, and she sees general medical dermatology out there. Fontenelle Clinic is where Dr. Christy Hayes is practicing some days of the week, and that's also that primary dermatologic care out there. The specialty care clinic is for the HIV dermatology multidisciplinary clinic that we do. That one's actually about 5 minutes up the block. So that's been great coordinating with these different sites so that we can reach out to as many patients as possible. As far as the general dermatology rotation, it's broken down here. You're obviously going to be spending an extensive amount of time learning general dermatology because that is your foundation. So UNMC at the mothership in the main general dermatology clinics, it's going to be heavy front loaded, and then you'll spend more and more time in specialty clinics as you go along. As far as research, that's going to be 2 days per week where you have dedicated research time during your second and third year in residency here. And then this is just cases that we've seen over the last month that I included in here with, really, we want you to learn the breadth of dermatology. So not just hair, nails, general on the skin. We have a case of sarcoidosis up here, an extensive oral lichen planus associated with hepatitis C. We want you to learn all the bedside diagnostics. So doing Woods Lamb, doing KOH, doing mineral prep, doing zinc, all that. Alongside dermoscopy, a lot of us, we feel very passionately about using dermoscopy and at least getting familiar with it and trying to see if you can integrate it into your practice as a helpful tool to help assist in your diagnoses. So we go through all of that in the general dermatology clinic as far as multidisciplinary clinics, we have the Rheumatology Dermatology Clinic with Dr. Arthur and Dr. Medlin, who we spoke about. And they meet frequently. I mean, right now they're every other week, but I swear you're going to overflow into weekly at any moment. They have a very robust clinic there with just the absolute most complex cases that you're going to see as far as rheumatology, dermatology. An important thing to keep in mind is that as the main academic center in the region, we get referral cases from not just all across Nebraska, but throughout surrounding states as well in the region. And so really the referrals that are coming in here, we're not competing with other major academic centers. They're all coming in here, and for Rheum Derm, they're all coming in to see Dr. Arthur and Dr. Medlin at this clinic. Our HIV dermatology clinic, which I had mentioned, I work closely with Dr. Swindles and Dr. Berries there, who are infectious disease doctors specializing in HIV there. And I'm able to coordinate with them and have one location for our patients to get care. And this is a picture of one of my Kaposi sarcoma patients. It was pretty extensive. We also have our cutaneous lymphoma clinic through the Fred and Pamela Buffett Cancer Center. Dr. Wysong's leading that up alongside with our medical oncologist, Dr. Vos and Dr. Lunning, and radiation oncology, Dr. Inke. So really, these are all things that we created because we have a passion for them, and so if you build it, they will come. We have patients flooding in to come see us for these specialized clinics for a higher level of expertise and for coordinated multidisciplinary care to make sure that that we're working together to make sure that patients are receiving the absolute best care. And in the works is our melanoma and high-risk skin cancer center, which is really exciting. We're developing that right now, so hopefully by the time next year rolls around, we'll have more details on that.
And so we just wanted to give you guys a little sneak peek of just some of the fun and interesting cases that honestly, Dr. Adams and I have just seen these all within the last week. And so we kind of nerd out about it because we have so much fun talking about these cases. But yeah, again, just to kind of showcase, I think that not only are you going to learn, you know, the bread and butter dermatology and whatnot, but you're going to see, you know, really, you know, interesting cases and complex cases. And again, the goal is for you to feel very comfortable managing these patients. And so the first case that I put up here on the far left-hand side is actually a really fun one to talk about because it's one that Dr. Adams got as a teledermatology consult where patients actually send in photographs themselves directly to us to say, hey, what do you think this rash is? And certainly when she reviewed these pictures, she was concerned for something, you know, kind of more serious that could potentially be going on. Certainly the differential is very broad. And I was able to see the patient the very next day, and his biopsies are pending, but we're kind of thinking that he might have possibly eosinophilic cellulitis or Wells syndrome right now. And then the patient on the right-hand side is a little girl who I've been following who's got juvenile dermatomyositis, and so just kind of showcasing some of the pediatric cases that we're able to take care of too. We've got a pediatric rheumatologist in town, Dr. Reinhardt, who's really wonderful, and so I'm able to work pretty closely with him on some of these cases, and she's doing wonderful on methotrexate. This is a super sweet lady who has alopecia universalis, and you can see here with the photograph of her nails developing some trichonychia with her condition, and so we're getting her started on tofacitinib, which hopefully is going to make a big difference for her and improve kind of her outlook and quality of life. Another kind of interesting one that actually again came through the Teledermatology portal and was correctly identified by Dr. Adams as something that was going to be, a possibly severe skin condition, and this woman has kind of gone on to progress into kind of full-blown calciphylaxis, and so we're treating her with some intralesional sodium thiosulfate right now. One of the benefits, I think, of our hospital is we've got some really wonderful specialty pharmacies that are really willing to kind of mix up whatever kind of medications that we feel like would be beneficial as far as intralesionals go. And so we do intralesional sodium thiosulfate, Efudex, methotrexate, cidofovir. And so it's just one of the ways that we're able to really provide the best care possible for these patients. And then just a couple of other fun ones. So the top is a patient of mine who we see in the room derm clinic who had really extensive discoid lupus with lots and lots of scarring and failed numerous immunosuppressants, including rituximab, and she's clearing up very nicely with isotretinoin. And then finally, patient I saw just the other day with very, very extensive frontal fibrosing alopecia on 4 systemic medications and continuing to have active progressive disease. So.
And this is just a look back on my clinic this past week. So on the far left, we had a patient who is coming in to full-blown erythroderma, and he actually had, he'd been treated for the past 2 years elsewhere for atopic dermatitis, but we were able to get some biopsies and find a clonal T cell population. So he has erythroderma, cutaneous T cell lymphoma, and we were able to get him into photophoresis this past week to start up on treatment, found to be skin limited. Over here, I have a patient from my HIV dermatology clinic that I've been following that is it has hypertrophic herpes simplex virus, so it turns very exophytic rather than the ulcers that you're used to, and that really happens in our HIV/AIDS population. Just some extensive keloids up there, failing numerous other treatments, and then an extensive pyoderma gangrenosum actually eroding into the mastoid bone there below. So very high degree of complexity and pathology that we see in our clinics every single day. So it's, you don't really blink anymore when the crazy cases come in, because we're used to that as a referral center. And these are just a couple other cases just showing that we see the whole breadth, really. Here's another oncologic patient that was undergoing treatment with an EGFR inhibitor and developed this rash over her face and over her back, which is very typical for those. And she's failed numerous treatments. We're getting her started on a new regimen now. There's just a picture of dermoscopy with lichen planopilaris. I love doing dermoscopy in my clinic and try to integrate it into as many disorders as possible. I have the picture of thalidomide because I just this past week we had another follow-up over the phone with one of my lepromatous leprosy patients who's completed treatment for her leprosy, Hansen's disease, but she's been experiencing erythema nodosum leprosum, a reactionary state that can even happen years after you've completed treatment. So thalidomide works great for that, and actually with thalidomide, we were able to get her off of the steroids that she's been on for the past 2.5, 3 years outside, where it's completely debilitated her otherwise. And now we've gotten her on down to this month, we're actually going to be stopping her thalidomide. So she's done fantastic with it. And then up here in my clinic, I saw a PEDS case this last week where you can see that it's absolutely sparing the trunk, and then you see these tiny little papules down the extremities. And this was a beautiful textbook case of Giannotti-Crosti, or papular echodermatitis. You can see a little zoomed in picture of these pink papules over the thigh here too. And is interesting because you think about it post-viral, and he actually had a COVID positive PCR this last month. So this is post-COVID Giannotti-Crosti syndrome.
So last night, Dr. Wysong was kind of joking that we're very spoiled and that we have really, really beautiful spaces that we get to kind of take care of patients in, and the VA is certainly no exception for that. So we are really excited. They have actually just kind of added on this $86 million expansion to our Veterans Hospital, and it's open now, and our residents are going to be starting there starting November 1st. And so here's just kind of some pictures of what the interior of that's going to look like. Currently, our residents are going to be going over to the VA two of them are going to be going over 2 days per week to kind of do some general dermatology and excisions clinics. And that's where some of our volunteer faculty, Dr. Herder and Dr. Madsen, they're wanting to teach our residents over there. And so I think it'll be really fun for them to get that exposure too. So varying degrees of time will be spent at the VA throughout the residency, and kind of most of it kind of early on during the PGY2 year, and then again kind of revisiting a little bit more when you do kind of your chief VA year, where you can chief VA months rather as a final PGY4 resident, so you can kind of really, again, practice lots of procedures and whatnot. Certainly, I think all of us trained at places where there was kind of a veterans hospital associated with it, and it's a really excellent learning opportunity. And so we're really happy to be able to provide care for these folks.
So to talk about pediatric dermatology, I see adults and pediatrics, so does Dr. Hayes. And as I mentioned, she is boarded in pediatric dermatology. We also have Dr. Suleski, who sees children as well. And as far as our goals for our plans for the future, we are actively recruiting right now for 2 pediatric dermatology positions for full-time pediatric dermatologists. Below there, you'll see our children's hospital, which is enormous, and we've signed our contracts with them. We're building out space right now that should be opening this next year. It's 10,000 square feet for dermatology there, and that's going to be in less than a year. So we're going to have our residents rotating through there and seeing pediatric dermatology through all of our clinic spaces. So 1 month is dedicated to that during your first year, PGY2 year, 2 months during the PGY3, and then another month during PGY4 with at each step of the way, and this is true of all of our rotations, it's really important for us to have graduated autonomy where you take more and more ownership each step of the way. So we're there to help you no matter what, and to be there for guidance, but we really want our residents to, by the end of your training, to walk into any room, be able to take care of it, feel prepared to take care of it on their own and not just as an observer. And then these are just a couple of our cases here, some eczema herpeticum and linear morphea crossing over the knee that's actually doing very well on methotrexate in that kiddo.
All right, derm surgery. So this is fun. I love dermatology, actually all aspects of dermatology. So this is a lot of fun for me to get to chat with you all, and thanks for being here tonight, and then have Dr. Adams and Dr. Arthur here. It also makes me really miss Grand Rounds that we put a freeze on for a few months, so I can't wait for it to restart. While looking at Kodachromes and thinking through these fun, complex patients. So I'm one of our dermatologic surgeons, and I love cutaneous oncology. That's a passion of mine. Also like quality improvement and really quality of life impact of dermatologic disease, and specifically skin cancer on patients. And so that's a lot of kind of my research and academic interests. So our derm surgery program is really composed of kind of all aspects of dermatologic surgery. And that was one of the things that really got me the most excited when thinking about coming back here to Nebraska to help start and build this program. It was about 3 years ago that I was talking with Dr. Wysong, and she was discussing the potential to come back and help start the skin cancer program here. And I remember really just kind of, not knowing exactly what it would be like, and coming onto campus and visiting and just really realizing that the opportunity was tremendous to really build a program with a bunch of great minds to how do we take the very best care of patients with all types of dermatologic disease, and then how do we build a residency program encompassing all the different things that we've all loved about our different residency programs across different parts of the country. And there's really no other time where you'd have the ability to do that. So we've had many fun conversations about how do we really make this the strongest training program ultimately in the country. And I think we're off to a really good start and have a lot of growth potential. So we'll go on to the next slide, and I'll first want to talk about didactics, because I think we'll talk about didactics a little bit more, but this was really fun for me because I got to really sit back and reflect on my experiences as a rotator, my experiences as a resident fellow. What are all things derm surgery that are really critical for a resident to know and be exposed to, from the really common things, and to more rare things like hair transplants and veno-lymphatic medicine and cosmeceuticals and things that I think, coming out as a really well-rounded and dermatologist, these are important things to know. So we developed a robust derm surgery curriculum. There's 4 hours monthly that we do derm surgery lectures. And then there are also several hands-on sessions throughout the year, about 5 to 6. So this was one that we had just a few weeks ago. We were actually doing a suturing session on synthetic skin. It used to be pig's feet, now it's synthetic skin, so it was nicer and a little bit cleaner, but this was tons of fun. I feel strongly that I want to get everybody involved early on, hands-on, but really build a very strong foundation of derm surgery technique that we can build on as the years go by and through graduated responsibility. And so this was great. We were getting experience with excisions, with sutures, and really kind of building the foundation that we've already been able to apply with our residents. So that's our kind of our high level surgical curriculum. The next slide we can move on to is cutaneous oncology. So this is what I love. This is my passion. So there are myself and then the chair of our department, Dr. Wysong, who are 2 fellowship trained Mohs surgeons. And so one of the 2 of us is doing Mohs surgery every day of the week. And this is our microscope in our clinic here. You can see it's a 3-headed scope. So we always have learners there. And then we can also post it on the TV so everybody can look at what's going on. And so this is awesome for teaching. It's awesome for learning. We can take photos. We can put them into presentations. But we really enjoy taking care of patients with really all different types of skin cancer. But I think what was really important to me was to build a program where we could take care of not only kind of bread and butter, but ultimately the most complex types of skin cancer in a multidisciplinary way. And so this has been a lot of fun to build relationships and work with our colleagues in other subspecialties. So it really requires interdisciplinary care. So we attend our monthly head and neck cutaneous tumor board, where we bring our complex patients with high-risk squamous cell carcinomas with risk of metastasis, or invasive melanomas that need a sentinel lymph node biopsy, and then Mohs surgery for the melanoma, and discuss these complex patients and how to best care for them. We also, in May, we officially launched our Mohs for melanoma program. So we've been, for about 8 months, we've been doing immunohistochemical stains in our lab and really just kind of perfecting things. We do them for high-risk squamous cell carcinomas, but also for melanoma. So a patient can come in with a melanoma, we surgically remove it and clear it that day with Mohs, and then reconstruct same day. So I think that this has been really, really awesome for patients. And in the patients who need sentinel nodes, they'll go to the OR, get a node, and then come back to us for the Mohs surgery if it's on the head and neck. So I think, again, really been a lot of people working really hard to get this up and running, but I think it's been really good for our patients. So this has been a lot of fun, and more to come on this. So we've got, we will have formal multidisciplinary clinics, but right now we've got a close working group of people who think about skin all day and and love taking care of patients with complex skin cancers. And as everybody here is probably aware, Dr. Wysong is really a national leader in many things, cutaneous oncology, but specifically squamous cell and high-risk squamous cell carcinoma. So how do we think about how do we manage these patients? What adjuvant therapies do they need? How do we stage them? And so starting to develop a pretty nice cohort of patients with high-risk tumors here. Next would be lasers and cosmetics. And so we recently welcomed Dr. Selesky to the department in April, and it has been absolutely awesome having him on board. He is introducing many different types of new cosmetics procedures to our department. So there's Dr. Selesky and then both Dr. Wysong and I. And so this was actually, we had, this is Dr. Adams' dad that was here, gave us permission to push this photo, but we were actually doing a hands-on laser session just a few weeks ago, and I just done a little pulse dye laser. So first and foremost, laser safety, and then get hands-on. So I think 5 weeks in, our residents had their hands on an ATV, PDL, and a few other lasers. So we've got lots of different lasers. We have 7 different lasers on our main campus, and we've got 3 different lasers at the VA too. So lots of different opportunities to get really comfortable with lasers and laser physics and how to take care of patients with laser technology and cosmetics. And then the last thing I just want to touch on, because I think that this is quite unique to what we do, is both Dr. Wysong and myself are fellowship trained in veno-lymphatic medicine. So we take care of patients with symptomatic vein disease and are able to manage them with both conservative measures, but also minimally invasive treatments, including endovenous laser ablation, ultrasound guided foam sclerotherapy, ambulatory phlebectomy. And this is just a picture of, and I should have updated it because now this is completely healed. So, which makes me so happy every time I see this patient. These are some of the most fun patients to treat. So this gentleman had come in with 10 years of venous ulcers, beautiful lipodermatosclerosis that he has, and had kind of a complex history with some history of deep vein thrombosis. And we treated his greater saphenous with endovenous laser ablation, his small saphenous, and then did some injections along with some intense compression therapy. And this is him just a few months after initiating therapy. So just the complete change in the texture and quality of the skin, and he no longer has ulcers on this leg, and he needs a knee replacement, which he can now get. So definitely something where you can improve quality of life for these patients that have long-standing venous ulcers. And so we see ulcers of all different types, calciphylaxis, PG, but venous ulcers, and these can be challenging, but also really rewarding patients to manage. So that's just kind of a high-level overview of derm surgery, and I think it's really rewarding to work together as a team to really take care of these patients. And so you get to work with our colleagues, and just ultimately we're here just to take really good care of people. And I feel like that's what we are able to do on a day-to-day basis, and working with residents and teaching them and having them engaged in patient care is incredibly rewarding for all of us, and I really enjoy it. So yeah, lots of fun stuff going on the derm surge side.
Okay, so next we're just going to talk a little bit about our consult service. And so again, you're going to get a little taste of consults every single year within the residency. And we do have kind of the 3 main kind of areas. It's all on one campus, but they're kind of like separate different towers or buildings, if you will. And it's very convenient that they essentially are all interconnected. And so we can actually walk from our Lauritsen Outpatient Center, where our main outpatient clinic is, and completely through using just skywalks in between buildings, we can get all the way to the other side of the campus to the Fred and Pamela Buffett Cancer Center without even stepping outside, which is great when it comes to winter in Nebraska, which I assure you isn't that bad, but it's always nice to be able to walk inside. And this is a really busy, fascinating, awesome service. And we'll talk a little bit about some of the cases that the residents have seen so far. And I know Dr. Wysong mentioned last night that, we are a huge transplant center. And so, for many reasons, that makes our outpatient clinics incredibly interesting, and in particular for Dr. Sutton when it comes to those high-risk skin cancer patients especially, but also when it comes to, treating patients who have graft versus host, seeing those kind of more rare infectious diseases presenting in these patients who are immunosuppressed. And so I think it's been a really good experience. And all of us, most surgeons to general dermatologists have covered the service at one point in time. I'm going to shout out Dr. Sutton, who also made a diagnosis of cryptococcal cellulitis last year. It's just been fun, the kind of things that we've seen. And so I think that residents will just learn so much through seeing these inpatient consults. And so it was really fascinating because literally, I think it was the very first day that our residents, we were supposed to be sitting in a room doing orientation, and we were supposed to be talking about policies and, things that, aren't always like the most engaging things to sit through. But Dr. Wysong and I were like, okay, she was getting all these consults of super interesting cases. And we said, you know what, guys, we're just going to walk over to the hospital and we're going to go see all these patients. And so we went from room to room and we saw SJS-TEN in one room. And the very next room we went to awful pemphigus vulgaris. And so you can see the pemphigus vulgaris gentleman is in the right hand upper corner there. And then the SJS-TEN, it was actually full TEN. He had a lot of body surface area affected. And then just, the next patient we saw right after that was bullous impetigo. And so they literally were able to see kind of 3 different bullous diseases all within the span of an hour and a half, and kind of, look at the distribution and the morphology of them and kind of see, okay, yes, they're all in this bullous category, but how do they differ and how am I going to be able to tell these apart? And so it was really cool experience for them. And for us, I think I said that we like to nerd out a lot, and we definitely, Dr. Wysong and I nerded out a lot after we went on those inpatient rounds. And there's a few more cases here that they've been seeing. So the top left-hand corner is a case of just kind of picture perfect classic calciphylaxis there overlying kind of the buttock and hip region. That palmar rash there is acute GVHD in a patient. And then the photograph, that's the center one on the lower, the inferior center one, that is actually a patient who presented with an acquired nutritional deficiency. And so she had all of the classic findings of it. She had oral ulcerations, angular colitis, prominent acral involvement, and then just kind of these eroded eczematous plaques and whatnot. And she had low zinc level and low B6. And Dr. Wysong has let me know that she has completely recovered. All of her skin has healed now just with repleting those nutritional deficiencies. So it's been an active and fun and really enriching learning experience, I think, so far for them. And I'm sure there's only more to come. So.
All right. I'm going to touch on these quickly so we can get to Q&A soon. But at least for elective rotations, really our goal is just that you get to spend time in literally anything that you want. So if you want to tailor your career, maybe do some more in pediatrics or do something in Mohs, you're preparing for a fellowship, you have that option for your elective time. This is how our schedule is laid out, but we do have flexibility with that. We want to make sure that it's personalized to you. So we have a resident now who's potentially applying for a pediatric dermatology fellowship. So in that case, you want to do some rotations earlier on. So maybe doing 2 months during PGY3 and 1 month during PGY4. And we have flexibility in our schedule for all of these because we really want to do whatever we can to make sure that you hit your personal goals and what you foresee your career being. We're all going to be trained extensively in dermatology residency, but the goal is to at least have that additional niche training that you also want. So you have that. You also have the opportunity for away electives. This is these are my personal away electives, my dream away electives, but everyone's a little bit different. So you can do international electives, which we have programs set up around the world who can pair up with you. Continuity clinic, I'll mention, it's so every 2 weeks you have continuity clinic. It's going to be booked directly under your schedule with you as the resident. So this is just, I screenshotted today's list here, and Dr. Swally is the provider for these patients. She had that excision for the squamous cell, she had biopsied it herself in her continuity clinic. She brought the patient back to return so that she could excise the squamous cell, and so we're really making sure that you have ownership of those patients, and that graduated autonomy too throughout the years of residency. You have flexibility to do procedural continuity clinics where you have more focus on lasers, cosmetics, excisions, and to personalize, maybe stack your continuity clinic with more of the patients that you want to see as time goes on. We want everyone to have exposure of everything that walks in the door early on, but certainly as time goes on, if you feel very confident in all of general dermatology otherwise, and you want to focus on a certain area of the patient population, then we have flexibility with that as well. Vacation time, 20 days a year, and you can take that in 1 to 2 week blocks. There's continuing medical education is very important as well. So we have 5 days allotted for that, for traveling to conferences. Teledermatology is obviously taking the nation by storm, taking the world by storm. So we've actually been building this out for a while, but everything's sped up with COVID, of course. So we have video visits that are basically appointment times, just like any other appointment, where we can meet with patients in their own home. We have e-visits, which is a store and forward visit, meaning that the patient can send pictures and fill out a little questionnaire that we have on the electronic medical record that asks questions about a rash or acne or a lesion. And it's a very specific questionnaire that they click through. It gives us the information that we need to evaluate the photo, and we can respond right back to them through the email, through the patient portal. We can prescribe all their meds, and so it's direct patient to dermatologist care. E-consults is where other providers are able to contact us and reach out with pictures of patients that they've seen in their clinics. So mostly primary care, internal medicine, family medicine. We're working with them closely on that. And it allows increased access to care for some of these patients. Phone visits as well. If patients are having issues with technology, then we have means to even have a visit over the phone. So, and we're working on projects right now, and we're working in conjunction with some software developers on some ideas for innovating in the field of teledermatology and increasing access to care, and things even like full skin checks. So we're working on that at all levels. This is a picture of Lyme disease that came in otherwise, and so that just came through the consult service. So we were able to pick up on that diagnosis and get her started on medication. Training in the time of COVID is obviously very different, and this is a learning curve for everyone, but we thankfully, because we have such a robust telehealth platform, we're able to fully transition into telehealth for the vast majority of our patients. So continuing to see high volumes of patients throughout this. We continued Dr. Sutton continued dermatologic surgery for all of our patients with aggressive malignancies where they could not afford to wait until after the COVID epidemic passed. So he did a fantastic job of triaging all of our patients that needed to be seen during that. So that's still ongoing. And then Nebraska Medicine is also a leading COVID researcher, innovating to protect providers as well through our biocontainment unit work. You've probably seen us on 60 Minutes and all these shows with the work through the biocontainment unit, which is just a leader in emerging infectious disease. And we do the training globally for global health security. So, and these are a picture of a COVID patient that I saw up on the top left. And then also through our research on COVID manifestations, Dr. Wysong and I are are working on a study where, unfortunately, those who pass away from COVID, we get consent for doing biopsies, evaluating the manifestations in the skin in patients that have passed away. So this was a patient who we got to see during autopsy. Additional opportunities in emerging and infectious disease dermatology. We have the biocontainment unit, as I mentioned. So all the consults that come through there are coming to us. And as far as the National Hansen's Disease Program, we're partnered up with them. I actually, during my residency, I did elective time there as well. So I have a close relationship with the team for National Hansen's Disease. And we've, honestly, since we've been here, there were barely any cases, and already in the past 6 months, I've picked up on 3 new ones. So we're seeing a good amount of that coming through the woodworks, and honestly, it's there in the refugee population. It's just undiscovered as well a lot of the time. And speaking of refugee health programs, it's really important to us to do those outreach efforts to make sure that we're delivering care to the underserved in our area. And so that's a particular passion of mine, and something where I'll talk about the Omaha Refugee Task Force. If anyone's interested with our residents, we like them to get involved as well, but delivering care to these populations where it's a gift as far as education, because you get to see skin diseases from across the globe. Our resident educational experiences, we do have partnerships with places all around the world, but residents are certainly able to reach out and look into other experiences as well. But Tanjit University, we have a long-standing partnership with through the medical school, but we actually had the chairwoman of Tanjit's dermatology department rotate through here for 3 months. She got to stay with us, and so we're very close with them, and looking forward to an exchange of residents and learners through this program. South America as well, in Peru, in Haiti. This is me with one of our wonderful dermatologists, Chesley, out in Haiti, and she's working closely as a dermatologist out there that I partner with a lot. Tanzania as well through the Regional Dermatology Training Center, and Thailand through Mahadol University. These are some partnerships that I've developed that I can vouch for and say that they're fantastic training environments. But absolutely, we're looking forward to any other partnership in the future where we can go out and explore. And this is a picture at the bottom of one of my Hansen's disease patients, and then some dermatologist providers I work with out in East Africa. And I'll just mention this quickly. Nebraska, our state slogan is the good life. And that's for a reason. I like to just mention this for people wondering about diversity in Nebraska. We are absolutely diverse, but specifically looking at immigration and refugee population, 7% of Nebraskans are immigrants, they're foreign born, and another 6% have at least one immigrant parent. So the population is up 28% since 2010 of our immigrant population as well. We do have about 12,000 refugees from 36 countries that have resettled in Nebraska. And this I'm very, very proud of, Nebraska leading the nation in resettling the most refugees per capita. This is from 2016. And so I was proud of that as our state. And this just a breakdown of the different countries just in 2019 that have come to Omaha and Lincoln.
Okay, so we're going to switch gears and just talk a little bit about didactics. And I think that this is one area that I think it does kind of set us apart from some other programs, because we have a really, really robust didactic program for the residents right now. They have 8 hours of protected educational time every week. So Wednesday mornings and Friday mornings is completely devoted to any and all educational activities. And one thing that is also very unique about it is that really the majority of this is going to be faculty led. So, you know, that's us, you know, the dedicated faculty here kind of, you know, talking to the residents about all the cases that we've seen and reviewing, you know, all the the textbooks, Bologna, Andrews, and the most up-to-date literature on these things and whatnot. And then additionally, another thing that we're doing is, of course, we've got our Grand Rounds program where we have kind of, guest speakers come from all over the country who are really kind of, world renowned in their specific topic. And we have it set up so the Grand Rounds Grand Rounds occurs on a Tuesday night. And so they usually will plan to stay the night. And then the following morning, they'll have a didactic session and kind of a mentoring session with our residents. And so that's kind of another really excellent opportunity for them. And then Dr. Sutton already kind of spoken quite a bit of detail about just the number of hands-on workshops that are available. So busy slide, but really just to show, we've put a lot of thought into the didactic curriculum, and so much so it's very organized. Like Dr. Sutton was saying, we kind of make sure we've got our 4 hours of dermatology surgery didactic each month, and then we've got our hands-on workshops, which occur on the 5th Fridays, and then we kind of just have it laid out as to kind of specific derm path lectures, gen derm lectures, pediatric lectures. There's occasionally basic science lectures that are going to be occurring. Lots of Kodachrome sessions where really it's just, slide cases, and we say, tell us the morphology, what is your differential, what is your workup, and just kind of working through through those cases. In my experience through residency, those were some of the most beneficial sessions and really just the funnest of all of them. And so we're really kind of coming up with, just a nice kind of a combination of things that we all thought was really beneficial for us through our training. And again, just to kind of mirror the didactic sessions, the lectures that we're giving, we've kind of come up with a very detailed reading schedules, kind of depending on the year of the trainee. And so kind of more Bologna focused when you're first year resident, Andrews second year, and then kind of focusing in on some of the board review textbooks that are available in your final year.
So for conferences, Dr. Arthur already mentioned Grand Rounds once a month. It is on hold during July through September, but we're excited to get back started up this September, and we do have internationally known visiting faculty that are coming. They give an hour lecture, and we have patient visitation and discussion of interesting cases, and we also have a dinner catered as well during that session, with the next day the faculty staying on and lecturing to our residents for their own personal session. I have Dr. Antonella Tosti's book here. She wrote a lot of the books and runs the journal for hair and nails, and she's going to be lecturing this next month for us. Dr. Wysong says, you're welcome to join our virtual Grand Rounds on the first Tuesday nights. So feel free to email Tammy O'Donnell, who sent you the link, and she'll add you onto the list. This is really going to be spectacular. So we have lined up fantastic speakers throughout the year, and it's our opportunity to bring in a different perspective for our residents in their education. We have monthly journal club where we review all the important, relevant journals out there. And we love just feeding off of each other's energy and our curiosity, and really teaching amongst ourselves and with the residents together. Conferences, we already mentioned the hands-on surgical workshops. We also have a biannual morbidity and mortality conference that's very valuable to kind of learn from our mistakes and learn from each other. Resident monthly meetings where the education team meets with the residents and figures out what's going on, what's working, what's not, and what can we do looking forward. We have research meetings that are weekly, and that's optional. It's for those interested, but we do have a really active research team, even public health partnerships and our MD PhDs, and we have a great team if you're interested in doing research. And then national and regional academic meetings. This is definitely encouraged and supported throughout the department. We want to help make sure that our residents have access to presenting on the national and even international stage, and really getting out there and presenting at these academic meetings.
All right, so then just a little bit on well-being, because this is very, very, very important to all of us. And it's something that is going to be just an ongoing thing that you're going to have to work on throughout your career. So it doesn't stop in residency. It's something that I'm constantly working on as well. And so just some of the ways that we're trying to again, kind of promote well-being amongst our residents is, so Dr. Adams had mentioned kind of every other week on Wednesday afternoons right now, our residents are doing their own continuity clinics. And on the other days of Wednesday afternoons in those months, they actually have kind of dedicated time really for them to just get caught up on any and all administrative activities, whether that's, you know, they need to catch up on that chapter of Bologna or call back their continuity clinic biopsies that they had done the week prior, or if it's just that, you know, I need to get my teeth cleaned because, you know, it's been a year and I'm behind and I need to get in to do this, and it's hard when you're in training to get that kind of stuff done. And so we give you some kind of dedicated time to do that. We do have 2 resident retreats that occur each year, and that's really completely up to the residents, whatever they want to do. I know our residents were kind of talking about maybe going golfing and whatnot, just to kind of spend some time and do it in a COVID conscious way. And we've got a lot of departmental and group activities as well that are constantly going on. And of course, most of these are pre-COVID area, but you know, welcome barbecues. Vala's is a really fun outdoor pumpkin patch that's in the area. Our zoo is awesome, and so different events going on there. Dr. Wysong hosts an annual Halloween party, and actually we always dress up every year. The clinic, there's always a theme. Last year our theme was, who do you want to be when you grow up? And so Dr. Adams dressed up as Sherlock Holmes, and I'm pretty sure she's actually already Sherlock Holmes. So and then a holiday party, and just, you know, so many things going on just to kind of keep everybody connected. Again, we're just one big giant family, and so we like to kind of celebrate that together. You do get meal money. We do have a dedicated dermatology library, and trust me, it is stocked full of all of our favorite dermatology textbooks. So you guys got the hook up there. And then this is a picture of the House Officers Association. This is a resident-specific lounge that's over at the main campus, and it's just an area to kind of kick back, relax, free snacks, drinks. And so that's a really nice space for people to hang out. And we're getting to the end here. Thanks for hanging through this with us through everything, guys. The last slide is just on mentorship. And, you know, I hope that throughout this evening and last evening's presentation that you guys really do get a feel for truly how devoted as faculty we are to our trainees, you know, residents and medical students. We're here for you guys. We want to pay it forward. It's very, very important for us because we have all been in your shoes. This is not easy to be applying to dermatology. It's especially not easy to be applying to dermatology in the time of COVID. And I know there's a lot of obstacles and whatnot, but you know, we're here for people, and we really want our residents to feel comfortable coming to us, and so we meet with them regularly. Dr. Adams and I are actually meeting with our new residents here just within the next month to check in to make sure that things are transitioning well, everything's going okay. And then there's going to be biannual meetings as well. And we do ask our residents to just identify a mentor, somebody that they just, you know, really identify with. It doesn't matter if, you know, Dr. Sutton's who you identify with and you don't necessarily want to go into Mohs surgery. You know, I think it's just somebody that you feel comfortable going to for any and all problems, just kind of a life coach almost. So, and then of course, you know, throughout the years as your interests further kind of evolve, selecting more kind of career specific mentors, we absolutely want to foster those relationships. And we just have a picture of Dr. Hayes on here because again, I just feel like so much of the tradition with UNMC started with her. And I think we all look to her as a mentor for all of us in the department. And so we're just kind of excited moving forward to have more trainees and more people to mentor, more people to spread all of our love and passion about dermatology with. We had gotten a lot of questions last night about Nebraska and, living in a rural area. I think there's a lot of misconceptions about what Nebraska is really like. And I know that we had mentioned that, kind of the greater metropolitan area is over 1 million people. And there's not a single cornfield in these pictures. Yes, we are a corn state and whatnot, but it's a very lively city. Omaha is, and I know that. So myself, Dr. Adams, and Dr. Sutton, we all kind of grew up in this area, and so there's a lot that Omaha has to offer. If you're a foodie, there's awesome restaurants, and we've got the College World Series that typically comes every year in June, which is a really fun event. There's so many different fun little neighborhoods that are kind of just kind of getting more and more hip, I guess you could say, as time goes on, and so we feel lucky to live here. I think it's a great place to live, a great place to train, a great place to raise your family. And you wouldn't believe it, but also these pictures here are also from Omaha. Again, not a cornfield in these pictures, but just beautiful landscapes. The bottom left-hand picture is taken at the Omaha Zoo, which is really thought to be kind of the #1 zoo in the country, actually. So I'm sure Dr. Adams and Dr. Sutton may have more to add about their love for Omaha. So I'll let them have a chance to talk too about it. But yeah.
Yeah, I personally, I mean, all of us have lived, our faculty have lived all over the United States. I personally have lived in Boston, Philadelphia, Phoenix, Miami, and I think that Omaha kind of offers the best of both worlds as far as still having that city urban feel, but it's easy to unwind and go out into other areas of Nebraska. I found out that we have vineyards in Nebraska, and got to go to a winery. And down here you see Chadron State Park, which is beautiful space, and we have the Lewis and Clark Park as well up there with some beautiful water features too. So really there's so many layers of not just Omaha but Nebraska that I think you really don't realize until you come here. I think some of our attendings who have not lived here before and came here for interviewing or for the position, I think have been really surprised about what is here. So actually, Dr. Swali is one of our resident physicians, and she can talk to that certainly about not really realizing what was here before she came here for residency, and I think she's been pleasantly surprised. So.
Yeah, and I echo what both of you are saying. I mean, I think if you haven't been to Omaha, you've probably flown over Omaha at some point. There's a lot more going on in Omaha that I think most people appreciate. It's a really it's a lively, culturally diverse city with a lot going on. You got your urban, you got your kind of suburbia, and whatever suits you. It's definitely here. And everywhere is really accessible in Omaha too, which is awesome. There are tons of flights everywhere in the country, so it's really easy to get around to where you want to go, and you're in the middle, so nothing takes all that long to get to. It's a 3-hour flight just about anywhere in the U.S., which is awesome for visiting friends, family, colleagues, and things like that. So it's a great place. Omaha's a fun place. We'd love to show you guys around sometimes. So, but nice choice on the picks. I like it.
So this is us. This is our dermatology family. And so I think hopefully we've shown you that we're passionate and, and that we like to have fun. We like to take the best possible care of our patients as we can. And all we want to do is, again, mentor and share that experience with our trainees and, just really give them, the training that they need to become the dermatologist of their dreams.
So just a reminder, tomorrow our residents are going to start off the webinar, their webinar series, where it's going to be just the residents speaking candidly with you guys, question and answer format, and they also have a few slides prepared. There will not be any faculty on the webinar. It is not being recorded at all. So please feel free to ask whatever questions you have of them, and we really want to make sure that it was an environment where you felt safe to do that. So check your email from Tammy for the Zoom link, and that's tomorrow night, same time. Yeah, that concludes tonight. So thank you very, very much for joining us. We're actually going to switch gears and do the Q&A. If any of you have questions, please pop them into the Q&A box. So first off, I see that there's a question about suggestions for applicants not from the region or do not have a home program who are interested in the program. So absolutely, we absolutely encourage that. We want people from all over the country to apply for the program. So it's not something, we have a very holistic approach to reviewing applications, and it's not something where it says, oh, you're not from Nebraska, cross you off. No, we actually really want that. And we want our program to be a diverse background with people from all different experiences, all different regions of the United States. And I think that really helps us feed off of each other to really bring different experiences together while we're learning. So as far as not having a home program, I'd say as far as letters of recommendation, things like that, just have people that know you really well, know that you're passionate about dermatology or, you know, different areas, things that you focused up until this point on. I think just showing that you have a passion about something is what speaks the most to us. So seeing that passion, seeing that dedication, and seeing that hard work really shine through, then those are the features that we're looking for a resident. Certainly if you have something that you like about our program, then you should specifically say that in your personal statement. It doesn't mean that you have to be from here, but at least, you know, we would appreciate to know why you have an interest in us. So it could be, you know, I love doing XYZ from your presentation today, and that is my passion, and that's something that I feel like Nebraska could really offer me, and just highlighting that. I don't know if Dr. Arthur or Dr. Sun, if you have anything else you want to add on that.
I think you hit on all the high points. I agree wholeheartedly with everything you said. I'm seeing another question just about, oh yeah, so any opportunities to work with the indigenous population, and stating that Nebraska is home to multiple Native American populations. Dr. Adams, do you have any kind of comments, I guess, on that question?
Yeah, so we don't have a program specifically working on the reservations. However, what we do have is throughout rural Nebraska, we've been opening up our teledermatology services, specifically focusing on rural areas. And so we have seen patients through that are going to their primary care providers, coming from the reservations and Native American population. So we have been able to see basically everyone out in rural Nebraska through our teledermatology telehealth services. We do not currently have something set up specifically dedicated to that group.
Awesome. And then there's another question I see here about as far as kind of opportunities for graduating residents to stay on or to come back as faculty members. And as Dr. Wysong mentioned last night, so we do have big plans for this department, and you know, we want to continue to grow the family here. And so I think the answer is absolutely, you know, I think that we would love to be able to have people that we have gotten to know super well through training and whatnot stay on and continue to work and care for patients side by side with us. And so, so yeah, I would say that would be definitely a possibility.
Dr. Wysong mentioned last night, but before the department was established here, we're 50th out of 50 states per capita for dermatologists. And so there's an enormous need. We have a huge number of patients waiting to get in to be seen. So our department's growing all the time, and Dr. Wysong had spoken a little bit more about our enormous recruitment efforts to get more dermatologists here, and we want to make sure that we have every area of dermatology represented. So right now, I think it was somewhere between 7 to 9 positions that she's recruiting for over the next couple of years at least. So yes, we are growing all the time, and looking forward to building a very, very large, robust program.
And then a question about the flexibility with the elective schedule and the opportunity to spend more time on the consult service. And yes, that is absolutely something that we would accommodate if somebody wanted to get more consultative service time, absolutely. And then again, you know, also possibility to look at doing inpatient consultative rotations at other programs as well too, so. And then,
do you always work with the same attending in your resident continuity clinic? So, I'm Dr. Adams. I'm basically the director for the continuity clinic, and I'm usually in there. However, we do have points throughout the year where we specifically have time with other attendings who can bring in their expertise. So, for example, coming up in September, we're going to have a clinic where they can focus more on procedural dermatology and work with lasers and cosmetics with some of the continuity patients. So what I want is that you have exposure to all the different attendings with your continuity patients, where you can get their expertise as well, overseeing it. But for the most part, I'm running the majority of the continuity clinics, and then we do have sessions set aside where you're with other providers. And Dr. Wysong also mentioned that during PGY 3 and 4 year, there's going to be opportunities at the VA with other attendings, and that's another point there. You're going to have some continuity patients out there. We have our visiting attendings from outside the program out there, and our attendings rotating through the VA.
And then also a question just about plans for starting a skin clinic for uninsured patients. And I think that that's definitely something that's in the works. Dr. Adams, correct me if I'm wrong, but we're kind of looking into this currently with the One World Clinic, correct?
Yeah, so I was actually supposed to have a meeting with our local clinic that serves just either underinsured or uninsured populations, undocumented patients, because that is an interest and a passion of mine, and we're looking forward to possibly teaming up with them with doing a continuity clinic there as well with our residents. However, right when our meeting was about to hit was when COVID kind of tumbled down in front of our lap. So right now they've put that on hold, but we do have plans to expand that in the next couple of years. So that is going to be our very important future thing that we're looking at.
I will say 2 other things in addition to kind of uninsured or underinsured is Dr. Arthur and I, about a year ago, so there is an uninsured clinic here. It's called the Sharing Clinic. It's medical student driven and overseen by faculty. And, you know, we've offered our services there to help out. But one of the really neat things about Nebraska medicine is that we actually have the ability to care for people who are uninsured and underinsured. And so I think probably a day doesn't go by where we have people with limited to no insurance that are seen in probably every single one of our clinics. And so there is a really strong foundation and commitment to taking care of all types of patients. And so that is something that we do every day in our clinics. And I think we can grow on. I think One World would be awesome. I actually saw a few weeks ago a patient from One World with large, deep melanoma on their foot. So we're seeing those patients, we're getting them in. If they have issues that need to be treated, we're figuring out how to take care of those people. But I think more formalizing it moving forward. There's another question here, I think, asking about medical students. We love medical students. We have tons of learners of all different levels that are are in our clinics. And so we usually have at least 3 to 4 medical students that are with us and rotating through our different clinics. And so lots of opportunities to get involved for them, whether it's grand rounds, rotations in clinics. We also have summer research. So I've had the last couple of summers, I've had a medical student, and I know Dr. Wysong is, and I think Dr. Adams has maybe had a medical student, Dr. Arthur, so that work with us for projects dedicated over the summer and then have some continuity throughout their years. So tons and tons of opportunities for teaching, and we want the medical students to work closely with our residents too, because having all levels of learners is part of what makes it really fun.
I see the questions on dermoscopy as well, for dermoscopy dedicated lectures during the year. So yeah, so that's something that's important, that we want to make sure that our residents feel very confident with. So we actually had a dermoscopy course that we had the residents do early on that due to COVID is online, a virtual course, but yeah, we have dermoscopy resources that we make widely available to the residents, and we're actually integrating it into every clinic otherwise. But we have dermoscopy lectures. Even actually this next month, we're having Dr. Antonella Tosti, who I had mentioned is one of our Grand Rounds speakers. She's giving a talk specifically just to the residents on dermoscopy of hair and nails. That's why I had the book up there as well. So we're having visiting lectures with that as well, but we do have dermoscopy within the curriculum.
And then there's also a question about if there's any plans to move towards a primary dermatology admitting service. And I think that I don't think there's any real immediate plan to switch to that at this time. I think that, you know, as our department continues to grow, you know, who knows what could change as far as that goes. But for now, we're going to kind of remain as a consultative service, and kind of probably the next steps in kind of our consultative services is going to be that once we have additional faculty coming on board, and again, the full complement of all 9 residents, then we're going to be looking to expand services to taking consults at the Children's Hospital as well as at the Veterans Hospital. And I know Dr. Adams trained at a program where she was as a resident, they were kind of running the primary dermatology, had a admitting service as well. And so I think that we would have somebody who kind of would be on the inside of how, kind of the details as to how that would work if we were to go that direction.
There's currently, I think, just 2 in the nation, so it's not a common thing. It's I think the consultations on inpatient is going to be the most educational, the most vital for people to learn. But yeah, we have that as an option in the future. I see also a question about how does an applicant express their dedication to dermatology if they fell in love with it very recently. I can speak from experience. I did not know that I wanted to do dermatology until basically right before 4th year started. And so I applied within months of finding out. So it's not something that is held against you in any way. And as far as expressing your love of dermatology, I don't think that you even need to do that. I think you need to really show us that your passion. I think anyone can, your passion in general. So if your passion is working in, of course, I'm always thinking of global health, but other examples are out there. But if you're passionate about something and you've worked really hard in that, then it doesn't matter what field it is. I personally had research experience in vascular surgery, so it had nothing to do with dermatology. But I was able to kind of show through my hard work and dedication in that area that it's something that I was going to apply in the field of dermatology, and why I discovered that switch and that love. And honestly, I think it's as long as you're passionate and hardworking and that shows through in your application, then that's what we're looking at. It's not that, oh, I've known since I was 2 years old that I was going to do dermatology. That's not what we're looking for.
And then just another question about kind of applications and whatnot. As far as what we look for and how we're reviewing them, and if there's a cutoff score. And And there's no cutoff score for us as far as filters for going through these applications. Again, we really do plan to review everything on your application. And I think there are maybe some things that maybe carry a little bit more weight. You know, again, we kind of mentioned as far as like letters go, how we're very interested in hearing from people who know you, kind of vouching for you and kind of telling us what their experience has been in working with you over the years and whatnot. So I think that rather than trying to get people that you've maybe only worked with for half a month or here and there, you know, really focusing in on the people who can kind of speak to, you know, your personality and your dedication to the field of medicine. And again, it goes back to what Dr. Adams was just saying. Again, you don't have to have a bunch of dermatology specific research. You just have to show that you're dedicated to the field of medicine and to patients. And as long as you've kind of worked towards that throughout your medical training, I think that that will come through in a very positive way.
Okay, I think that that's it for questions. Thank you all so much for joining us. It's been a very, very fun session for us. It's very exciting for us to really just talk about what we're building here, what we're working on. Like I said, we all came here for this opportunity to build a department, to build this residency program, and to share our absolute love of dermatology with trainees. And so it's exciting to actually see it all together in PowerPoint form and everything that we love about the field. And I hope that you're excited about it as well. And we look forward to reviewing your applications. Please join us tomorrow. Well, not us, but please join the residents tomorrow for another discussion on the program.
All right. Thanks everybody for joining. We had such a great time over these last 2 days.
Take care.